the Yoga Alliance thing you wrote properly. Everything was good.
Yes. Yes.
It's going for the newsletter?
It is Dr. Devendra wrote actually, and I just added some things.
Oh, okay. Well, you wrote very well.
So what you have written in my response to my question, should I add or it is already covered?
So what I wrote was because you were asking me the importance of Yoga Alliance. So I just sent you what the importance of Yoga Alliance is. But you explained was explained pretty well. We don't need to add it.
Okay. So Dr. Devendra explained actually.
Yeah. I think it was fine. I just because you were asking that question, I made that
Okay, just it is
for your
it is for
information.
my knowledge.
Yeah, for your knowledge. And the doctors, if we want to add more, we can, but I don't think we need to. This is fine too.
Yes, you can add any name if you want because all are contributing in the course. So you can just.
Right. Wasn't sure whether we wanted to include everybody or not. If we want to, we can add the other names.
Okay, now it's because I am sending to Sreni Bhai for giving in souvenir.
In the souvenir?
Yes.
Oh, okay.
It is for updating the souvenir.
Then we should include everybody because I will check look for their names.
Vandami, we are live now. It's already 8, so we can start.
We can start and we'll include everybody. I'll tell somebody. Okay. All right. So let me introduce Neelam Mehta. Hang on a second. Can people hear me?
Yes, we can.
All right. Okay. So today's talk is going to be by Dr. Neelam Mehta. She's another one of my daughters who's in anesthesiology at Orlando Health, ORMC, here in Orlando. She did her medical school training at Thomas Jefferson University Hospital in Philadelphia and went on to do her residency in Emory in Atlanta. And after completing residency, she decided to residency in anesthesiology. She decided to come back to the nice warm weather of Orlando. So she's here with us today. She's going to be joining in halfway through the talk. The initial talk is going to be on the common pain conditions and their anatomy, and the second talk will be about management. So we're going to start the talk and you can hear what she has to say.
Hi everyone, my name is Neelam. I'll be giving a talk on common pain conditions, the anatomy related to these common pain conditions, and then part 2 will be more focusing on therapies and medical treatments that are commonly used for chronic pain. So the goals for this talk, we'll be talking about the most common chronic pain conditions that affect different muscles, joints, and the spine. We'll also go over just the basic anatomy that is involved with all of these pain conditions and how that plays into where and why we get pain. We'll also talk a little bit about how pain signals travel from the body and up to the brain and how the brain interprets these pain signals. And then we'll go over common patterns that we see with pain and how movement sort of plays a big role in chronic pain. So why does understanding pain matter? First of all, pain affects all of our movement. So anything related to posture, well-being, anything we do in day-to-day life, pain can affect all of these things. Pain often does lead to changes in our posture, tension in our muscles. We tend to avoid certain movements when we have pain because of the fear that the pain will come back. This is why understanding the anatomy that goes into pain helps to explain why these changes occur in our body and why we sometimes will see pain in the same areas over and over. Additionally, awareness of pain and the anatomy behind it helps us understand why certain movements and yoga and other therapies do work to improve pain. So what is chronic pain? chronic pain is technically defined as any pain that lasts longer than 3 months. It does not mean that you have an injury currently or an ongoing injury, but it can often be due to an injury that happened at some time in the past and the pain continued past that sort of acute phase. A lot of the times, chronic pain will persist past when all of our tissues, so muscle, bone, whatever it is, has healed after some sort of injury. This chronic pain also is often affected by posture and movement patterns, whereas with acute pain, that's not necessarily always true. And then the other component of chronic pain and the reason why it lasts so long is that usually there are some changes that have happened in our nervous system. So things involving our spinal nerves and how our brain interprets the pain that cause it to go past the acute phase. So what are the types of tissues that produce pain? Pain can originate from any different type of tissues that we have in the body. This can be joints, this can be bone-related pain, this can be secondary to nerve pain, this can come from muscles, it can come from tendons, so there are several different locations where pain can originate from. The difference is that each type of tissue does produce a different type of pain. Muscle pain may feel more achy, while nerve pain can feel more sharp. And this can change over time. This can change depending on the injury. And this can change depending on the person as well and how they're interpreting this pain that they're feeling. How does pain travel from our body up to our brain, and then why do we experience it as pain? So to simplify this a little bit, we have receptors that are in our tissues, meaning that, for example, in our hands, in our feet, we have receptors there that let our brain know that we are feeling something. These receptors will send a signal that travel along the nerves that are in our hands, our legs, or feet, anywhere in our body. The signal travels along these nerves, and it first hits the spinal cord, which is a set of nerves that lives in our spine. And this is what acts as a relay center or communicates between these peripheral nerves, meaning the nerves that are in our arms, our legs, more outside parts of our body, between those parts of our body and the brain. Once these signals have reached the brain interprets these signals and makes a decision as to how intense and how threatening that pain is to the body. And this is based on multiple different factors. It can be based on the injury that's happening at the time, the context of that injury, any prior experience with the pain. And once the brain has made these sort of decisions, it'll interpret these signals as pain to some degree, and it sends those signals back to our body, which causes us to feel pain. So the most common types of chronic pain usually come from what we call musculoskeletal pain areas. Basically, this means some combination of muscle, bone, and then tendons that hold those together. So because of this, some of the most common pain sites that we see are usually related to joints that carry a lot of weight or are very important in day-to-day activities and maintaining posture. So some of these are your neck and your shoulders, your upper back and your lower back, your hips and your knees, and then some smaller joints such as your hands, your wrists, your feet, and your ankles. These areas tend to experience the most repeated stress in day-to-day life, which is why they are some of the most common sources of chronic pain. The spine supports our body and protects the spinal cord and allows movement. The basic anatomy of our spine is that it is broken up into 3 components. The component in our neck is called the cervical region, our upper back is called the thoracic region, and our lower back is called the lumbar region. This spinal anatomy, depending on the part that we are focusing on, does provide different roles. The cervical spine tends to support movement of the head and also carries the weight of the head. Our lumbar spine carries a lot of our upper back weight, causing it to cause different levels of pain. Generally, the spine is in a tough spot because it needs to provide flexibility, but also balance that with stability and allowing us to stand properly, walk properly, and do our day-to-day functions properly. And for that reason, it can be very vulnerable to injury and to causing chronic pain. So we're going to start up at the top with neck pain and common causes of neck pain. As I had said earlier, the cervical spine, so this is the spine that's part of your neck, supports your head, but also allows for rotation and for bending. These muscles and joints that are up in your cervical spine are constantly working to maintain your head position. And because of this, the neck can be very vulnerable to fatiguing, becoming tired, to having neck strain. We think about people that are sitting at desks for a long time, staring at computer screens, and even just that stiff spot, head posture. Your cervical spine or your neck spine is working very hard to maintain that. The cervical spine itself has 7 vertebrae, which are the bones in your spine that help to support the head. In between each of these vertebral bodies, or these bony prominences, there's a cushiony disc that lives in between that sort of acts as a cushion to help stabilize movement and to absorb shock whenever movement does happen. From around these discs, there are nerves that live in our spine that exit between these bodies. For that reason, these nerves can also sometimes be vulnerable to being injured, causing chronic pain. So some of the most common causes of neck pain, as we talked about, muscle strain and fatigue, these happen just from posture changes, day-to-day working life, or overuse injuries. We can also get something that's called cervical spondylosis. Basically, this just means normal wear and tear of our cervical spine. What happens with this is that those discs that act as cushions between those bony bodies of our cervical spine can start to degenerate or become less functional as we age and over time as our neck becomes used more, causing those bones to kind of bump up against each other, which can cause significant pain in the neck. People can also experience nerve sensitivities in the cervical spine. This can be when the nerves get trapped in these small spaces that they live at, and we can get pain in the neck, or also pain that kind of radiates or travels to the shoulders and to the arms because of this. Moving on to the shoulder, this joint is also very vulnerable to pain and has a little bit of a complicated anatomy. It's called a ball and socket joint. What this basically means is that there is a bone with a head that's sort of rounded that lives inside another bone. These two bones are usually connected by tendons and by muscles that help to stabilize movement. The thing with the shoulder is that it is functionally used for a lot of movement more than it is to be stable, which is why it can be so vulnerable to injury. Because of that, the muscles around the shoulder play a very big role in making sure that that joint stays put and functions as it should be. Chronic shoulder pain usually involves issues that have happened to the tendon or to the joint. Most of the time, this comes from overuse injuries. So people that may be playing a sport or any other reason for them to be overusing their shoulder joint are likely to have chronic shoulder pain. And this can be from anything due to the muscles, due to the tendons. We can have tears in the tendons, which can cause pain and are hard to recover from and hard to repair. You can also get stiffness in the joint over time, which occurs just generally with aging, but also just from overuse. And some of the worst pain that we can get from chronic shoulder movement is when we do overhead motion a bit too much. The shoulder doesn't like to be brought up above the head or behind for very long periods of time or repetitively, as that can move this ball and socket out of its normal position. Moving down to the lower back, or the lumbar spine, the lumbar spine has a primary function of supporting our body weight, especially when we're standing, but also when we are sitting. As we had talked about those vertebral bodies in the cervical spine, the lumbar spine has a smaller number and larger vertebral bodies because strength is more key in the lumbar spine. So we're really relying on these bones and these joints to support all of our weight. Similarly to the neck spine, there are discs in between each of these bones in the lumbar spine as well that help to absorb some of the shock and some of the load of the weight that we're trying to carry with the body. But again, when there's repeated stress, this can lead to pain over time. Some of the most common causes of lower back pain, and generally lower back pain is one of the most common chronic pain conditions that we will see. Many come from muscle strain or ligament sprain. These are things that can happen in day-to-day life that have probably happened to most of us, where some funny motion, some strange movement, we felt a little twinge in our back and then caused something that caused pain that lasted a little bit longer than the injury. Other more long-term or serious causes of lower back pain include disc herniation. Essentially, what is happening here is those cushiony discs that serve as shock absorbers between our bones can shift sometimes. And because they live very close to where our nerves are exiting the spine there, they can compress the nerves or squish the nerves or basically limit those spinal nerves from sending their appropriate signals, which cause them to send basically incorrect signals that the body interprets as pain. We can also see osteoarthritis of the lower back or the lumbar spine. This basically means just age and wear and tear, normal degeneration of the spine that happens over time. And then finally, we often do see something called spinal stenosis. This means that two bony prominences, so two of those vertebrae, are rubbing up against each other because either the cushiony disc has been lost or some sort of anatomy change has happened where that nerve no longer has room to live between those two bones. Moving on further down to the hip joint. The hip joint, kind of similar to the shoulder joint, is also a ball and socket joint. This hip joint involves the femur bone and the pelvic bone, and that's kind of your ball into a socket. This joint, similar to our lumbar spine, is mostly designed for strength and stability. So mostly designed to help us walk, help us maintain our posture, and help us to carry weight as we transfer weight from our spine to our legs when we get up or sit down or walk around. Because of all of this, the hip joint specifically is lined with a very thick line of cartilage that's called the labrum, and then fluid sacs that are related to this to help shock absorb. There are many muscles and tendons that also surround and attach to the hip. This is also because of how important the hip joint is with movement and posture and stability. Something to remember about the hip joint is that the sciatic nerve leaves our spine and travels right around our hip joint and right around that area of our body. And so it can often be a location where we feel a lot of sciatic nerve pain. And that is a very common chronic pain condition that we see over time. Some of the most common hip pain conditions aside from the sciatic nerve, again, we have osteoarthritis. So similar to what we saw in the neck spine, so the cervical spine and the lumbar spine, you can also get osteoarthritis of the specific joint. This is usually felt as a more deep pain because it's related to the actual ball and socket that we're seeing. So the actual injury is at the level of the femur bone playing into the pelvic bone. This can happen for many reasons. Most commonly, this is due to wear and tear over time or just overuse, as the hip is supporting a significant amount of weight. You can also see what's called bursitis or tendinopathy pain. These pain conditions from the hip are usually felt more on the outer hip, and these are due to inflammation that happens in the fluid sacs or the tendons that surround that joint, as opposed to being actually related to the joint itself. This inflammation can happen due to a number of things, But again, most of the time it is due to wear and tear over time and overuse. We sometimes do see tears in the labrum, which is that thick sort of cartilage lining the hip joint. That can be felt either as an achy pain or a sharp pain, just depending on the mechanism of that injury. And then finally, we do see nerve impingement. We talked about the sciatic nerve, but there are a couple of other nerves that live around the hip joint and travel right around the hip joint that can sometimes get caught in the joint or in the motion of those muscles and those tendons, causing nerve pain. Moving further down the body to the knee. So in terms of the anatomy that is related to the knee pain, our knee acts as a hinge joint that is between the femur bone, which is the bone in your hip, up in your upper leg, and the tibia bones, which is one of the bones that lives in the lower leg, in the lower part of your leg. This knee joint also has a patella bone. That's what you feel, that's what your kneecap is, what you feel on top of your knee, that protects the joint and helps to improve leverage as your knees move around to help your legs move, walk, sit, stand. We also have this meniscus cartilage. So these are cushions, kind of similar to those discs that we talked about, but these are cushions that live around the joint to help stabilize the joint and to cushion the knee joint. We have meniscus on both the inside and the outside of our knee. Both are susceptible to injury. And then there are several ligaments in the knee that can get injured. We commonly see this in athletes. There's an inside and an outside, and then there's also an anterior, meaning towards the front of the knee, and the posterior, meaning towards the back of the knee. So these 4 ligaments are all technically prone to injury and can be sources of pain as well. What are the most common sort of knee pain conditions that we see? So osteoarthritis, which is similar to every prior condition, is probably the most common cause of chronic knee pain. And this occurs from breakdown, inflammation of the cartilage over time as more stress is put on the knee as we use it more. We can see injuries to the meniscus, which were those that cartilage that cushions the knee, or to the ligaments. This can be ligament strain or actual tears in the ligament that take a bit longer to heal, which can also cause chronic knee pain. We can also see tendonitis. This is just another word for inflammation of the tendons in the knee, and these tendons are what help connect muscle to bone. We can see bursitis as well in the knee. As we saw in the hip pain, bursitis is inflammation of fluid sacs that surround a joint. So this can happen with just irritation, with a specific injury. It can happen with degeneration or overuse. And then finally, anything that is causing worsened pain when we take stairs, or if we squat, or if we're standing for too long, those are all generally contributed to knee pain issues. So those are all of sort of the main joints, or what we call musculoskeletal chronic pain conditions. There are a few other pain conditions that we talk about when we talk about chronic pain. One of those is related to muscle pain, or what we call myofascial pain, and trigger points. Some of you may have heard of trigger points in general. Colloquially, or what we know them as, are sometimes tight balls that we feel in certain aspects of our muscle that are sources of pain in certain muscles that we feel. And we don't always technically remember a cause or an injury, but they form a tighter and tighter ball in that muscle with worsening pain over time. If you're having pain in your muscle, usually that is a reflection of overuse of that muscle or of some protective movement because you're concerned about pain that would happen if you were to exercise that muscle. Once you have had this overuse or some sort of injury, you can form what is called the trigger point then. And once you have a trigger point, these can cause the pain to sort of spread beyond the original area of the injury. So you may have a trigger point near your shoulder blade on the right, as you see in this photo, but the pain spreads all the way up into close to your shoulder or up into that side of your neck just because you formed this trigger point. All of this can cause stiffness in these muscles. You can feel weakness over time after decreased use, and we can sometimes even see lack of normal motion or reduced range of motion of these muscle joints because of how painful it has become for that person to move them. Another common chronic pain area is nerve-related pain. So we've talked a little bit about nerve-related pain as it pertains to our spinal nerves and to some of the nerves that live near joints. But generally, nerve pain is very different from musculoskeletal pain, which is what we talked about when we talked about the spine and when we talked about the joints. Nerve pain can feel very, very different. Most people often describe nerve pain as feeling sharp, a burning sensation, sometimes an electric shock down their body, and sometimes they feel this nerve pain very far away from wherever it's even originating or where they feel like the pain started. Nerves tend to carry pain very far from the original source, and this is all due to the anatomy of our nervous system. We have nerves that travel from our spine and our back all the way down to our toes. And if we think about that sort of distance that nerve is traveling, there are several points along the way where the nerve can get injured, but then still feel that nerve pain all the way down through the whole path of that nerve. Most of the reasons that we get nerve-related pain are usually due to irritation or compression of those nerves. We don't always know what's causing the compression or irritation, but often it's the nerve getting trapped in between bone, in between muscles, or both of those things, or sometimes even due to a direct injury to your body from something outside. For example, you got into a car accident, you had an injury to a nerve in your arm or your leg, and now you get chronic nerve pain at that area. One of the most common ones, like we talked about before, of nerve-related pain is the sciatic nerve, which is very susceptible to being compressed or irritated, causing a very stereotypical pain syndrome sort of down the buttocks, the outside part of the hip, and down all the way in the back of the leg, some people all the way into their toes. So in terms of recognizing pain patterns, it's very important to distinguish between arthritis or musculoskeletal pain and then more nerve-related pain or muscle-related pain. The reason it's so important to distinguish between these two is because it completely changes how we treat the pain and how we determine what treatment is going to be the most effective. So joint pain, which is what we talked about in the beginning of this, usually stays local at the site of the injury or at the site of the joint. So for example, you have a knee injury related to the joint. The pain you're going to feel from that injury is most likely going to stay right at that knee area. You won't be feeling pain that's traveling down to your ankle. You're unlikely to feel pain that's traveling up towards your hip. You'll just feel the pain at the site of the injury or at the site of that joint, that knee joint. On the other hand, nerve pain is very different. Nerve pain follows the anatomy and the paths of the nerves that we know, meaning it radiates or it travels down those paths. So you may have an injury in your sciatic nerve in your lower back, but you will feel that pain all the way down into your leg and into your toes, even though it's very far away from that original injury. In addition, the type of pain, or what we call pain quality, is something to pay attention to as well. When pain feels more dull, more achy, things like that, then it's more likely to be related to a muscle or to a joint. When pain starts to feel more sharp or burning or kind of like a shock sensation, then it's more likely to be attributed to a nerve or some kind of nerve-related injury. We do get a lot of what's called stiffness-related pain, and this also is usually due to more joint issues than it is nerve issues. Stiffness is generally just more of an issue with the muscle and tendon that plays a role in a joint. So all in all, it's really important to remember all of these patterns because a lot of the pain that you'll feel or chronic pain that people experience can be tied directly back to anatomy or to the way that the joint or the body or the musculoskeletal system is made up. So the key takeaways from this part 1 of the talk, things that are important to remember. One is that chronic pain commonly involves the musculoskeletal system. So this is just to say that pain that we feel over time, lasting longer than 6 months, like we talked about, is more often than not usually involving your muscles, your bones, your tendons, your joints, your ligaments, or some combination of all of these things. The spine and other structures that carry weight are the most affected. So any joints or any parts of your body that play a key role in movement, in posture, and in carrying any kind of weight are more prone to having chronic pain or causing you chronic pain in the long run. Pain is very closely related to posture and movement. And this will kind of come play a role in the second part of this talk because it helps explain why certain movements, certain therapies related to movement, why all of those can be so effective at helping to treat pain or helping to at least decrease pain a little bit, because all of this is very closely involved together. Understanding the basic anatomy to these joints and to some of the system that does cause pain can help us better understand the locations that we experience pain and why pain travels in certain ways and why we limit our movements in certain ways as well. And then finally, if we have a handling of these basics, of the anatomy of pain, of how pain travels, of how the joints are all interconnected, this lets us better understand how we treat pain with different sort of therapies, medication versus physical therapy, et cetera, which I'll talk about in the second part. And I will pause here for questions before we go on to the next part of the talk. Thank you.
Okay, so Neelam has joined, I think. So if you have any questions for Neelam, please ask them now for that first part before we move to the second.
Hey, Janendra. Neelam, I had a question. So when you're walking, you don't feel the pain, but if you do like running or then the knee pain starts, is that something that you can explain on?
So most of that probably has to do with the amount of stress that you're actually putting on the specific joint. When you're walking, you are putting weight, but you're not putting as much force, if that makes sense, or impactful motion repetitively as when you are starting to run. So anything that's going to give you pain, it's always going to be some limit that you're reaching before you experience the pain. And it's important to remember, when you are hitting that limit, when you're starting to experience pain, that it's your body reminding you that this might be something a little bit out of your actual comfort zone or something that may not be good for that specific joint that you're stretching.
Thank you. And then one other question is arthritis a big factor of pain? Like, doctor says you have arthritis, and then there is, like, they say everybody has arthritis nowadays. So is that like a common thing, or what do we do? How do we know? And how long does it really take for your body to say, like 5 years, 10 years, where it'll be a much worse condition?
Yes. So osteoarthritis is probably the most, for like what we say is musculoskeletal pain, probably the most common cause of it. And we see pretty much every type of person, male, female, ethnicity, whatever, has some degree of osteoarthritis by a certain age. It's hard to give an exact timeline. Certain things do make you more likely to get osteoarthritis earlier. So diet changes, male versus female, hormone levels, certain sort of vitamin levels, things like that. All of those play a role in people that get osteoarthritis earlier versus later. There's also a genetic component to everything too. So if in your family, people got osteoarthritis a little bit earlier, you may be more likely to. So there's a lot of different factors, but yeah, very common cause for pain.
I see. And do you know if any research where vegan people get more of bone conditions versus other people? Any light on that?
I haven't personally looked, but I'm sure that that exists. And Dad might be able to talk on this more, but you're definitely more likely to have vitamin D deficiencies and calcium deficiencies in people that follow a vegan diet, which are really important to bone health, which then in turn would make your joints more likely to get osteoarthritic or become sort of decay a little bit faster. So my guess would be probably, yeah.
Okay. Thank you so much. Good information today.
Yeah.
Okay, so I think we can move on to the second part. We can't hear anything, Devendra.
The sound on that part starts a little bit later into that slide, so you might just have to let it play longer.
It's not even on. It's not on.
Hi everyone, my name is Neelam. I'll be giving a talk on common pain conditions, the anatomy related to these common pain conditions. So the goal for this talk is to understand the major treatment categories and how many of them are there. The idea here is to understand how these treatment categories influence pain. And a main takeaway is why, for chronic pain especially, we have to do many different types of therapies to treat it. There are strengths and limitations to all of these approaches that we'll go over as well. And there are several categories that
you understand that, Amish? Yeah. So like literally you can commit like a felony and the president can be like, no, that's okay.
So you can literally just like do 9/11
Yeah.
and they will be
The
like,
thing is, Amish, let's say I were to do something terrible like that.
Yeah.
Someone is probably just gonna kill me anyways.
yeah, sure.
Right?
Yeah.
So like
some will reduce tissue inflammation or irritation. Like we talked about in our previous talk, a lot of causes of pain that we have are due to overuse, to weight-bearing injuries, to irritation in nerves, irritation in joints, osteoarthritis. So a lot of our therapies target that specific part of the pain. Some of these therapies also can help to calm some of the overreactive pain signals that we experience. Many people with chronic pain, your body becomes very sensitive to certain pain signals. So you may experience one thing one way the first time, and then the next time you experience that pain signal, your brain tends to overreact and become overactive, causing you to experience that pain even more intensely. So there are certain therapies that help to target that aspect of pain as well. We have some therapies that also help to improve strength, both in the joints and in the muscles, help improve our mobility, and help improve our alignment or our posture. All of these generally will help with pain because they allow for motion to happen a little bit more freely. And then finally, we have therapies that also actually change how the brain can process pain. We know that there is a strong mental component to pain, both in terms of emotional and in terms of how the brain actually processes nerve signals and how that changes how we experience pain in general. The different categories of pain sort of management therapies. So one that we'll talk about is medication, and I'll go over just generally the big classes of medications that we use to treat pain. There are also movement-based therapies, so these are things like physical therapy or rehab centers that help and focus more on movement treatments for pain. There's also what we call mind-body approaches. These take into account a little bit better the connection to the brain and to the mind and how that plays a role in pain. So these are things like yoga, these are things like medication, etc. There are several procedures and injections. There's even some surgeries that people get for chronic pain as well. So we'll talk about a couple of those. And then there are lifestyle changes and movement practices that we can do as well for treating chronic pain. Each of these categories address a different aspect of pain because there are so many different ways that pain sort of presents itself. In terms of the medications that we use for pain, so usually medications are given to reduce symptoms of the pain, but don't actually help fix the issue and the structures. So basically the issue here is that we're treating symptoms, so we're treating the after effect, meaning how we experience pain, but we're not doing anything to treat the cause of the pain. Medications, however, are very good at targeting inflammation, inflammation in joints, inflammation in tendons, inflammation in nerves even, and they can even target some of the brain signaling as well to help sort of rewire the brain and how we respond to pain. Some of the issues that we run into with medications is that the effectiveness of them can vary between person to person. So one medication for a specific type of pain may work really well for one person and not work at all for the next person. We don't always have a good explanation as to why, because everybody experiences pain so differently. And then another downside to medications that's important to remember, they do all come with their own side effects. A lot of them are benign, meaning not very harmful, but there are many that, especially after long-term use, can cause very life-altering side effects as well. So some of the most common groups of medications that we prescribe for chronic pain, the first one and the one that most people know are anti-inflammatory drugs, or something that are called NSAIDs. So these are basically like your Advils, your aspirin, ketorolac, things like that that we use over the counter for day-to-day regular pain. These are very good at targeting inflammation and pain related to inflammation. Another group is Tylenol or acetaminophen. This is a separate group of pain, not necessarily targeting inflammation, but can help with that. There are also nerve targeting medications that we can prescribe. Some of the common ones that people know are called gabapentin or pregabalin. There's a medication called duloxetine as well that helps to change nerve-related pain and nerve signaling as well. We have classes of muscle relaxants that we can prescribe people that, as they say in the name, target more muscle-related pain and help to relax some of the muscle if that's what's we think is causing the pain. And then finally, opioids. So these are things like oxycodone, fentanyl, morphine are some of the more common ones. These are usually used for intense pain or as sort of a last-ditch effort if all of these other classes of medication have not helped. The reason being that opioids come with a lot of side effects, can be very hard for people to digest, and can are very strong medications, so people can really feel these effects very strongly. The next category of therapy for pain is physical therapy. So the main goal in physical therapy is usually to focus on restoring. So this means restoring movement. This means restoring you back to your level of strength. This means restoring your confidence in you being able to move without being afraid of the pain. It looks more at how the body functions and doesn't focus as much on exactly where the pain is felt. Physical therapy is very good for flexibility and for coordination, and it addresses more mechanical contributors to pain. So things that have to do with how your body and your joints move and how those play a role in pain. The nice thing about physical therapy, it's usually a one-on-one situation, meaning it can be individualized, so it can be specialized to you and your issues, and depending on your sort of injury that you're presenting with. So what does physical therapy actually target? Usually it is targeting some weak or inhibited muscles. So this means after an injury, you may be limited in motion in a specific muscle, scared to move a specific muscle, and physical therapy will try to target this specifically to help strengthen that area and allow you to move it better and thereby improving pain. It also targets joint stiffness, which is a common cause of chronic pain, and helps you generally with just better motion and improving range of motion in areas where that's become limited. It also helps to address fear. A lot of the times after injury, patients will be scared to move a body a certain way or a joint a certain way because of the pain that they remembered they experienced from before. So physical therapy helps step by step to kind of relearn how to do that movement without the fear. So in terms of the mind-body approaches to pain, these are better at recognizing the whole role of the brain and our actual nervous system in how we experience pain and shaping that pain experience. These category of these sort of therapies, so we see meditation and mindfulness as a mind-body approach to pain. We can see something called breath awareness. Relaxation and yoga practices as well kind of play into this because they overlap with all of these things. And then there are cognitive therapy approaches. So this is more sort of verbal therapy and retraining your brain into how we interpret pain, how we talk about pain. That kind of can help change how we feel pain. So the first one, meditation and pain processing. Meditation can be very useful in chronic pain and in treating chronic pain because it helps to reduce the stress component of pain. Stress plays a very large role in experiencing pain because it actually amplifies symptoms of pain. So meditation can help to kind of retrain the brain to not do that every time we're experiencing a painful symptom. Meditation also generally helps with emotional regulation, and because we know that there is a strong emotional component to pain, this eventually helps us experience pain in a better way without having as strong of an emotional component, or at least letting us regulate our emotions around pain a little bit better. Meditation also does change how our mind pays attention to pain. So we may become less wary of pain or less on edge of noticing pain because we practice more meditation, which allows us to cope a little bit better and become a little bit more resilient to these triggers that we may experience for pain in day-to-day life. And then finally, meditation has been shown to improve sleep, which overall helps to improve healing, restore functioning, and decrease levels of chronic pain. Yoga is another therapeutic practice that can be very functional for chronic pain. Yoga is good at combining multiple facets of pain. So it combines awareness of these pain signals. It involves movement, and it involves focusing on breathing, that help to sort of all come together to help us experience pain or treat pain a little bit better. Similar to physical therapy, yoga can improve overall flexibility and strength, which also allows us to recover from injury a little bit better, but also improves experiences with people that have injured joints or arthritis or pain that way. Something to remember specifically when practicing yoga, especially as a pain therapy, is that you need to modify it depending on the specific pain condition that you're using it for. We see here a lot of different yoga poses that are used for back pain relief, and it's important to remember that these yoga poses may not necessarily be effective in the same way for example, your hip joint pain or for your knee joint pain. Additionally, using yoga for pain therapy can help support generally regulating your nervous system, which then changes how your brain interprets these pain signals that come from the rest of your body. So overall, being mindful of movement and how you move can help improve pain therapy as well, and allow for more pain-free movement as you practice more and more. Moving on to procedural interventions and injections. So these are more on the sort of medical side of how we would treat pain. In terms of pain procedures, usually these procedures are targeting one specific nerve or group of nerves, a specific location of pain or a joint, or some sort of structure in your body that we have found to be the generator of the pain, so the cause of the pain. More often than not, they're image guided. So this means that we are using an ultrasound, or we are using a CT machine or a CAT scan or an X-ray machine to identify the location of this pain, and then to inject some sort of medication there to help with the pain. We usually go to these sort of procedures for pain when many or multiple other therapies are no longer effective, or just not enough. So we'll use these in combination with physical therapy, or use these to help somebody perform a little bit better in physical therapy because their pain's been decreased, or these will be used in combination with medication, or all of these above. So what are some of the most common pain procedures that we see? We'll often see joint injections. You'll see these in the knee, sometimes in the elbow, but really any joint that we can reach from outside the skin can be injected with medication to help with pain at those sites. A very common pain procedure is an epidural steroid injection. So this is basically an injection with a needle of steroids at a spinal nerve site in your back that help to calm down some of the irritation and inflammation in a set of nerves that may be causing pain. There are also targeted nerve blocks. So these are often done under imaging, like we talked about, where we find a very specific group of nerves, for example, in your shoulder, and we put numbing medicine, so things like lidocaine, that kind of thing, or steroids, to help block those nerves so they don't send those pain signals as much. And then finally, there's something called trigger point injections. So we had talked about these tight balls of muscle that form after muscle injury or muscle strain or muscle overuse. You can actually inject these muscle points with, again, lidocaine, so numbing medicine, that helps to numb the pain there and limit the pain signaling that happens, and can be very effective at reducing the pain that comes from these trigger points. So the limitations with these pain procedures, usually the effects only last so long. It's not a permanent solution, and it's not a cure because, again, it's not necessarily treating a cause, it's just treating the symptom. It doesn't involve anything to do with posture or with movement or with retraining or strength, so it doesn't treat the cause of pain in that sense. Usually you need to combine these pain procedures or these injections with pain medication or physical therapy or other things like that. So it's never a one solution or a one-way street to get to a cure for any of these conditions. And then finally, there are a lot of different medications or illnesses that patients have or things like that that make them not candidates for these sort of injections. So it limits it to only certain patients, certain procedures, or certain types of pain. So why does multimodal care work best for pain? Basically, what we're talking about here is, as we've seen, there are so many different components to why pain happens, and that helps to explain why there are so many different types of therapies that exist for pain and why most people need multiple different types of therapy to treat pain. Chronic pain usually involves physical issues, so these are things that we talked about, like the joints, the muscles, the tendons. They involve a nerve component, so this is when the nerves get trapped, when nerves get injured, and then they involve the more mental, emotional components as well. So this has to do with how the brain interprets pain signals, how our brain responds emotionally to these pain signals, and how sensitive we are to these pain signals. So there's all of these different parts that are playing a role in how we're experiencing pain. So in that way, if we do combine all these different therapies to address pain, then we're trying to address different causes as opposed to just one or two of these different aspects of pain. It's also very important to always emphasize that the goal is to improve movement and function and allow us to live our day-to-day life when we have chronic pain instead of only just treating symptoms. So it's very important to have a combination of these different therapies, or a little bit of both at least. This diagram here I like because it's a sort of good overall comprehensive look at how many different therapies there are that target pain, and it gives us an idea as to how complex and multifactorial pain can be and how different each person experiences different things, because one combination of all of these therapies may work really well for someone's sciatica and not work at all for somebody else's. So it's really important to remember that you need to individualize your therapies and what you're doing for your pain to yourself, and make sure that you're doing what feels safe for your body, and that you're paying attention to how your body's experiencing pain as you're going through all of these therapies. So our key takeaways here in terms of chronic pain management and therapies. One big thing, as I've said many times, is that there are so many different factors involved. So chronic pain is very, very complicated, and we've sort of only touched the surface. Medications, movement, mind-body therapies, and sometimes even procedures or surgeries are all different practices that play a role in therapeutic treatment or in the treatment of pain. There is, more often than not a cure for chronic pain. It doesn't exist, but we try to get people to a level of functioning that allows them to still live their day-to-day life. Understanding how these therapies work allow us to use them safely in day-to-day life. So this goes along with physical therapy, with yoga, even with medication. Having an understanding of how these therapies and medications actually work let us use them in a safer way and more appropriately. And then finally, a combination of different classes of therapy tends to yield to better outcomes. So using a medication with yoga, or meditation with yoga and with physical therapy, or some sort of combination of all of these different things, will allow people to treat pain better and recover a little bit better from chronic pain than it is if you just use one or two of these things. And that is everything. Thank you for listening. I'll leave some time for questions.
Thank you, Neelam. That was wonderful and very informative. Are there any questions? Please go ahead.
Wonderful lecture given by Neelam. And she has very well explained the medical causes, from medical point of view, the causes of the pains and all the situations, intricate, complex, complex reasons which are working behind the pains. So it is really very informative talk. So I thanks to Neelam. But I think things are very clear. So might be there is no question.
And tomorrow we'll go over the research papers and studies that she outlined for the yoga stuff. So I think it'll also make more sense that how yoga can work.
Yes. So should we continue the meditation session? If anybody has any question, they can ask. Otherwise, we can start session of meditation. Hello? Hope all are listening.
Yes, Swamiji, yeah, the meditation is good.
Okay. So, who is ready to give the session for today? Anybody? Come forward. Okay, so should I give this meditation?
Yes, Swamiji.
Okay. So sit in a comfortable posture. With a straight backbone and knee, keep both the hands in the posture of knowledge or Brahma Mudra, that is the mudra for Vitara. Close your eyes softly. With 5 Om sounds, we would start our session. Take long and deep breath. Make the sound. Om. 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 Relax. Relax your entire body, mind, and vocal cord. The goal of Praksha meditation is self-realization. Make a resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of meditation is relaxation with full awareness. Concentrate your mind on the big toe of your right foot. Starting from the toe, see each and every part up to the head. Giving suggestion to be relaxed. feel complete relaxation in the body, mind, and vocal cord. Now we will practice contemplation of endurance. Be aware of the total relaxation of the entire body. Concentrate your consciousness on the entire region of lungs, repeat 9 times the following words. The power of endurance is becoming stronger. My 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 power of endurance is becoming stronger. To increase your capacity of patiently enduring with equanimity, physical as well as mental sufferings. This contemplation is very important. You have to repeat this contemplation or affirmation at mental level 9 times. My power of endurance is becoming stronger. I am becoming free from intolerance. 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 Repeat this affirmation aloud and also at mental level. Visualize that the above words are written on the chest region in bright green color. My power of endurance is becoming stronger and I am becoming free from intolerance. This affirmation is written on your chest in bright green color. Read each word slowly and silently. Repeat this for about 5 minutes. Pain is also the topic of tolerance. Sometimes we take painkillers instead of that. There is pain in particular part and there is no other solution than tolerance. There are many such situations in life when we need to tolerate rather than to react. With your mind's eye, visualize everything around you, including the air itself colored bright green. Take a deep breath and slowly inhale. Visualize that you are breathing long streams of green color. Continue the breathing exercise for a few seconds. Now focus your attention on the center of bliss, situated near the heart, and visualize bright green light radiating from this center. Continue this for 2-3 movements. Visualizing this, repeat to yourself mentally 3 times. I realize that my positive attitude of endurance has become stronger. And I have become free from intolerance. I realize that my positive attitudes of endurance has become stronger and I have become free from intolerance. Again, concentrate your consciousness on the entire portion of lungs from neck to heart. Repeat the following syllable. Patience, patience, and patience. It is necessary to have patience to avoid intolerance. Visualize that the above syllable is written on chest region in bright green color. Read it slowly and mentally for about 5 to 10 seconds. The affirmation is going into subconscious mind and reflecting in your behavior. Now, with 2 long breaths, we will conclude our meditation. With 2 Om sounds, conclude the meditation. Om. Om. Now rub both the hands. Keep them on eyes and open eyes gently. So the meditation is up.
Very nice, Samiji. Different, very nice.
How it is. The contemplation is clear. Are you able to visualize the formation?
I think this was good, Samiji. This and tolerance are good things to visualize on them.
Okay,
Strong.
thank you. Anybody else?
Very, very nice one, Samriji. I've never experienced this before. Very nice.
So contemplation is to develop good habits, good values, and to remove the bad ones or negative ones. So you have to replace the positive affirmation with the negative ones. It is a kind of creating the benevolent waves on the malevolent waves above the malevolent. So it supersedes the malevolent, what we say, habits or karmas. So, okay, I think we have completed 2 contemplations. There are many other contemplations. So we will see how time permits us. For this week, I have already given 1 contemplation, that is the contemplation of health. So since we are talking about the therapeutic part of meditation and yoga, so it would be better that you can also practice that contemplation of health every day and see how far it is working for you. Each week I'm giving special meditation to practice. So hopefully all are practicing. Until and unless you experience the benefits, you cannot say things with confidence. So it is necessary at least 1 week you can practice and see how it will work. So thank you. I have shared the document of midterm exam. Might be all have noted. It is also shared in the WhatsApp group and also Google Classroom. So if somebody has any question, and if you think that the spatial exercise can be given each one, then I can give that one also. Okay. Since there are 3, 4, 5 exams, 2 hours exams on Saturday and Sunday, and also the quiz. So I have kept relaxed that whatever good you think that you have good expertise or command on that particular exercise, just you can demonstrate that one. My purpose is to see how you can give the effective sessions or guided sessions to others. Clear? So your presentation mode is more important for the exam. Okay, so come up with the all clarity of the concept of behind the any yogic exercise or meditational techniques or mudras, and also about the concepts. Okay, so and try to follow the same instructions which have been given in the manuals. Thank you. Now we can leave.
Great, well, Swamiji.
Thank you.
Vandami Swamiji,
Thank you.
Thank you, Samiji.
Thank you, thank you. So in this therapeutic part, I'm not sending any quiz, but if you think that quizzes are helping you, then I can create the quizzes, but because there is a midterm exam, so I'm not pressurizing or
it's
overloading.
fine. Yeah,
Okay. Yes.
that's good.
After midterm exam, I can start the quiz.
Yeah, I think so, Swamiji.
Okay.
That makes sense.
Yes. Thank you.
Okay.